The first rollout is going to be for healthcare professionals, which includes doctors, nurses, and paramedical staff. Which in our country we may be looking at around 1 to 2 crore people approximately who would be receiving the vaccine under that initial rollout. Then it would be probably the second layer of frontline workers, which are the sanitization workers, the policemen, and so on and so forth, the military, paramilitary, who would probably get it. And then simultaneously, we would have those populations who are above 50 years of age and who have got comorbidities. Comorbidities, which we know now are affecting COVID and are actually making them more susceptible to an infection and perhaps even having a severe infection, which is obesity, diabetes, hypertension, kidney failure. So these 4 or 5 comorbidities would be the patients who would probably get it first. And then the next would be below 50 years of age with comorbidities. And then it would be the general population. So that's the phase out which we are looking at. And this whole process may take up to 6 to 8 months for the frontliners and the comorbidities patients to be actually vaccinated across the country, which is the critical mass of 30 to 40 crores is what I mentioned about. Now, coming to the point of would this vaccine be coming into the private market or not? I think there would be a time when it would probably come into the private market. Currently, there are no such plans by the government to actually roll it out in the private market. Currently, it is going to be strictly controlled by the government. I think there are a lot of concerns among the people that should I be taking a vaccine or not? Are there any side effects? And if there are side effects, what are those side effects? If a person has had COVID, should he be taking a vaccine or not? These are the concerns which are there. And I would like to basically assure and make people aware that vaccination, of course, everybody has got a right, a voluntary right to sort of say yes or no. But in a public health system, when we are talking about, it is better to actually trust on the government who has taken due diligence to actually pass through or give an emergency approval for a vaccine, and then go ahead and take your vaccine when your turn comes in. Because that way you will be a part of the group who is actually vaccinated or not a part of the group who are choosing not to be vaccinated, and you would be left vulnerable. That's one problem there. The second aspect is that those people who choose to take vaccine and maybe they've had COVID in past, it doesn't matter. It has been fairly proven that even if you have had COVID and have some antibodies, the vaccine is probably going to only help you in building more antibodies and not going to cause any harm. Now, as far as the side effects are concerned, everything has a side effect, and the safety margin is looked at only when you have a benefit which is far outweighing the risks, and that's when the emergency approval is given. So some mild side effects like a bit of body ache, a bit of a fever for a 24 hours time after the vaccine has been given or not, are quite common, and they should not be deterrent for actually people using vaccines. Yes, people who are immunocompromised, people who are on medicines which make them immunocompromised, they should seek their doctor's opinion before taking vaccine. That's the only caution which I would say. Rest everybody else can take vaccine. People who have had COVID in the last 1 month may choose to wait for another couple of months before they go and take vaccine. But anybody who is more than 3 months in their COVID illness can safely take a vaccine. That should not be a problem. So these are some of the suggestions for and reassurance for the general people, which I would like to say.